Well, the shortage of physicians and other medical personnel in rural areas is a real problem. But one solution is to expose rural students to these careers early on in life. It's been known that young adults who grow up in rural communities are more likely to stay there when they begin their professional lives. Our Blaine Singletary has the story.
If you're looking for hardworking students who have embraced the rural lifestyle, look no further than the FFA.
I work with him every evening and walk him and teach him to brace, and that's going to pay off in the show ring.
That's Bailey Diffie, just one of thousands of Oklahoma's future Farmers of America. Aside from this passion of caring for livestock and entering them in shows, she also has a passion in caring for people.
I've always wanted to be in the medical field, but I never knew what I wanted to do. And then talking to Dr. Schrum helped me out a lot.
When we spoke to Diffie back in 2013, she was one of a handful of FFA members recruited by Dr. Casey Schrum and others, and put on the fast track to a rural medical career. It's all part of a program called Blue Coats to White Coats.
When we started that program, I think people on both sides of the fence kind of are scratching their heads and kind of curious about why would a medical school be at the state FFA convention. That was very intentional because we want to have medicine embraced in rural communities. And there's nothing more rural than FFA.
It's the hope of this program that these rurally raised young adults will be the perfect prescription for a rural Oklahoma that needs more medical professionals.
There are 4 things that will predict where a physician will practice, and it's where they grew up, where they do their undergraduate work, if their medical school has an emphasis on primary care, rural populations, and where you do your residency training. We're really wanting to focus on getting physicians who are going to be there and become a part of the community and really have an impact on those communities.
And it's not just the rural roots that have medical schools targeting FFA students and their colleagues.
But they also have a lot of leadership skills. They understand hard work, they understand taking care of something. They have a lot of qualities that we're looking for in physicians.
Programs like Blue Coat to White Coat create pathways for these young adults, especially those who would not have thought about becoming a physician otherwise, if they didn't come from a family of doctors or even college graduates.
If they don't have someone who can advise them about college, we want to make that easy for them.
And that's where Operation Orange comes in. Every summer, the OSU Center for Health Sciences travels across the state, partnering with other colleges and high schools to bring a dose of medical school to these students who might have an interest in it. That's done through pairing high school students with current medical students, like Jessica Sorrell and Cyrese Olivier.
We are all second-year medical students, and we are here just kind of exposing high school students to what opportunities they have in the health field.
I worked with the SAM mannequins, which basically simulate heart, lung, and abdominal sounds. So it's just a way we can practice.
So we're showing them some of the skills we learn as medical students and just hopefully sparking some interest for them.
It's not just about giving these high school students hands-on experience. They're advising them how to navigate the sometimes difficult road ahead should they choose to go in this direction. Sarah Bollinger was one of the dozens of high school students who came with this curiosity.
I think this is really important because there's you never know if you want to do it until you see it. So you get to experience it and you get to know, yes, this is what I want to do, or maybe this isn't what I want to do, but today I know that this is what I want to do.
It's these unique experiences that Jessica was thankful for when she was in their shoes.
I remember in undergrad, not so much in high school, but undergrad doing things like suture clinics and stuff through OSU that really made OSU stand out in my mind, and also kind of reaffirmed that I wanted to go into the medical field, or the health field at least.
And it's this spark, through programs like Operation Orange and Blue Coat to White Coat, that could shock life back into rural healthcare in Oklahoma.
Our mission at OSU is to provide doctors to underserved Oklahoma. And so I think starting kids young, letting them know that they can do it is really important, especially to show them ways that they can go back and serve their communities, letting them know that this is one way that they can do that.
Now, OSU Health Sciences is gearing up for another handful of summer sessions for Operation Orange. To find out how you or your high school student can get involved, we have a link to their website at okhorizon.com.